Pelvic diaphragm is made up of the coccygeus muscle as well as the covering fascia of the coccygeus muscle and the levator ani. So you can remember this with L and C. But the pelvic diaphragm is incomplete anteriorly because it has the urogenital hiatus there. So the urogenital hiatus is going to allow the passageway of the urethra in males and the urethra and vagina in females. The pelvic diaphragm is going to divide the pelvic cavity into two parts. First of all, we are going to have the diaphragm as a landmark, and above the diaphragm, we are going to have the main pelvic cavity, and below the diaphragm, we are going to have the perineum. Also, remember that for the anatomical directions of the perineum, superficial means inferior and deep means superior. So the perineum is inferior, that means it is superficial to the pelvic diaphragm. Now let's talk a little bit more about the perineum. So perineum is diamond shaped, and when you view it with the thigh abducted and you view it from below, you're going to see a diamond-shaped perineum. Now let's talk about the boundaries of the perineum from the anterior to the posterior direction. So anteriorly, we're going to have the pubic symphysis, then we're going to have the ischiopubic rami, and then we're going to have the ischial tuberosities, and then we're going to have the sacrotuberous ligament, and at the end, we're going to have the tip of the coccyx. So PIIST is the mnemonic for that. There is an imaginary line which connects the ischial tuberosities and divides the perineum into two triangles. So the anterior triangle is the urogenital triangle and the posterior triangle is the anal triangle. Anterior triangle has the urogenital orifices and the posterior triangle has the anus. Now let's talk about the lithotomy position. So for the lithotomy position, the patient has to lie supine with both of the hip joints flexed and abducted. And lithotomy position is commonly used for examination of the perineum and the pelvic examination in females. And the feet are going to be placed in stirrups for stability. Now let's talk about the perineal body. It is the central tendon of the perineum. It is the fibromuscular mass in the center of the perineum. This is the embryonic attachment of the urorectal septum with the cloacal membrane for both of the genders. However, in males, it is the attachment of the penis to the anus, and in females, it is between the vagina and the anus. So functionally, perineal body is a site for the attachment of various muscles and facial layers. The point of stability for the perineal integrity and functions is the perineal body. Now let's talk about the problems related to the perineum. So these are infections, injuries, or prolapses involving anal canal, urethra, female external genitalia, urethral obstruction or traumatic rupture of the penile urethra, epididymis, and testes infections.